Because a lot of the instability happens in the legs, we focus on strengthening the lower limb, particularly the hip flexors and the knee extensors. So I would use like elastic bands, for instance, give them strengthening exercises. I would use balance, like cushions for children, or little mini trampolines, and so that we improve the proprioception, because we know that the proprioception feedback from particularly the ankle joints, but also from the knees, is faulty, and they people have a different gait when they have Ehlers-Danlos.
And when what are the best exercises for improving proprioception?
Well, that would be your vestibular rehabilitation.
I was going to say, so we've just run a course on vestibular rehabilitation, but we weren't thinking particularly of hypermobility.
Yeah. So for little toddlers, for instance, if I find that they are behind in their development, I'll get the parents to not necessarily go out and buy lots of equipment, but just take like the cushions off the sofa and have them walk. Yeah. You know, so that they walk on different surfaces like sand or grass, and barefoot particularly. I give them particular exercises to develop the arch in the foot by getting them to maybe lift little pieces of leg over their toes from one bit to another. I mean, simple things like that. It needs to be a game for children. For older children, you can direct it more towards the sort of more normal type of exercise. But it's really about strength.
Right. In terms of an adult patient rather than a child, would you send them off to a strength and conditioning expert at the gym and say, go and do some heavy weights?
If they knew what they were doing. Because I think a lot of very good trainers aren't aware of the risks that someone with EDS have of overextending. And so posture and core strength is extremely important. Right. And like I say, I work hard on trying to improve my general awareness of how I use my body when I'm just walking, because otherwise I could be walking across the floor and all of a sudden I've gone over my ankle, or I've just done a
But given that the principle of strength training is that you're going to lift a weight to the point of failure within a very few repetitions.
Absolutely not.
That is going to tear tissue, which is not what
so you're far better off with lower weights and more repetition. So I tend to work from the principle that if you can do 20 reps, that's your goal. If you can do more than 20, you need to up the weight, and if you can't do 20, then you need to lower the weight. So that's kind of my principle for strength. But it also has to be done in the correct form. It has to be done controlled. I mean, you see so many people, using momentum when they're strength training, or not training the right muscle groups. Yeah.
Allowing a dumbbell or barbell to bounce at the elbows as they bring it back up.
I cringe when I see that. Yeah.
Yes. Yeah.